Good morning, Facebook. Happy Wednesday. We have made it to the middle of the week already and middle of February already. Time is flying. I am Megan Rogers from Indiana SHIP, the State Health Insurance Program, and I am up in Northern Indiana. And I am joined with my co-hostesses, Melanie Garland, who is in Southern Indiana, and Susan Spilly, who is in Central Indiana. And we do have some very special guests with us today that we will introduce as we go along with our live. We are sharing some love to our SHIP counselors. But before we get to those introductions of our special guests, I am going to turn it over to Melanie to get us started.
All right. Thanks, Megan, and good morning, everybody. And you can see our special guest with us, and we're going to get to those introductions soon. But first, we have a little slideshow to share with you of our volunteers in action. So we want to share them, show a little love to them this morning, and so we've got some pictures to share with you of them in action. So give me just a minute to get that pulled up here. All right. Make sure I know what I'm doing. Okay. Right. Oh, sorry, little technical difficulties there. We just wanted to show a few photos of some of the volunteer supervisors had submitted some pictures of their counselors during this last year during fall open enrollment and the many outreach events that all of our counselors seem to do. So we just wanted to shout that out and just, again, thanks for all you do. So, as we move along today, we want to introduce you to some of our guests. So, these are folks that are volunteering and certified SHIP counselors. So, they went through the training to be able to help folks with all of their Medicare needs. And we want you to put faces to the names. We talk about our counselors a lot and how much they do, but we wanted you to see and meet some of them today. All right. So, Megan, I'm going to turn it over to you to introduce your two guests today.
All right, thank you, Melanie. So I have two of some of my newer-ish counselors with us today. I have Dave McCarthy, who actually is not necessarily new to SHIP. He has been a counselor for 4 years in Florida. Is that correct, Dave? 4 years?
Yeah, yeah.
Okay. And then actually, it's kind of interesting. I was at a health fair in, was it 2023?
A year and a half ago,
Yeah,
whatever.
some fall of 2023-ish. And Dave came up to my table and he's like, well, I'm a SHIP counselor in Florida. and me and my wife are moving up here next year, and I want to be a ship counselor here. So I gave him the information, and sometimes when we have those conversations, there's no follow through, things happen. And lo and behold, Dave called me, and we trained Dave last year. And while Dave was getting trained, my other counselor that I'm going to introduce, Becky Zazik, who I've known for many, many years in her role at Real Services, an area agency on aging, as the CEO. And that's where I used to work as well. She also wanted to be a ship counselor. She retired and she was ready to do some community volunteering. And since she knew of SHIP from Real Services, that was a passion of hers or an interest of hers. And both Dave and Becky were in the same training session, and just some things worked out where we found a new location to do some SHIP counseling through Becky, the German Township Trustee, which is a new partnership for us in Indiana. And Dave was able to work with Becky to provide some training and mentoring as well. And I just think it's been a great partnership. And Dave and Becky, I'm very excited to have you with us. So, Melanie, did I talk enough?
I think you did great. All right. So, Becky and Dave, if you'd like to share a little bit information about, I know Megan spotted you up pretty good, but if you want to share a little information, please do so.
Well, I grew up in Indiana, but I haven't lived in South Bend for 35 years. In the last 10 years, I was in Florida, and I've been doing in retirement different volunteer things, and someone suggested I look into this. And so I went through my initial training during COVID when a lot of things were done differently. And, I wasn't sure what I was really getting into. And one of my first clients, and again, this was during COVID, it was all by phone, it wasn't face to face. My first clients was a gentleman who was just in the midst of doing chemo for brain cancer, and I'm thinking, wow, this is real stuff. And it's been rewarding. It has been very rewarding to help people when they don't know what to do.
Yeah, and when I was retiring, I knew I needed to figure something out, and we moved at the same time. The kids all live elsewhere. And I went to the German Township trustee office. I went to a board meeting, and afterwards I just said, "Do you need help in any way?" And their response was, "Bingo." I thought, well, it's not exactly what I had in mind, but I'll help with bingo. And then a little later, the opportunity came up to be a ship counselor. And I thought, wouldn't it be wonderful to put those two things together? So they agreed to talk to Megan and Susan, and thank goodness Dave agreed to work alongside of me because he knows everything.
Oh,
And if he doesn't, Megan does. So it just has worked out perfectly. I'm very grateful for every person that we've met and for the opportunity.
Thank you for what you each do. We really appreciate it. Okay, so Sean, would you like to introduce your guests?
Hi, good morning. Sean Swindell, and I represent East Central Indiana. And here this morning we have Rashenda Banks and Becca Jones with Neighborhood Health Center, and Cheryl Ferwerda in Grant County, Bridges to Health. So thank you so much, all three of you, for joining us today and all the work that you do. I kind of agree with Dave. Almost every day is something new or something eventful. But at the end of the day, it's always helping somebody and making a difference in what we can do for those people with their Medicare coverage and then some. I know the folks at Neighborhood Health Center and Cheryl with Bridges to Health, they do a lot more in addition to Medicare counseling. So they help in a lot of different insurance avenues, and it's just really great to have them on board.
Thank you. Okay, Becca, let's start with you. Let us know a little bit about what you do as a ship counselor and maybe even more. Oh, and we almost forgot. What is your favorite pizza topping?
Hi, I'm Becca. I am employed with Neighborhood Health Center. We offer ship services. I'm also a licensed navigator. I also assist with marketplace pathfinders. Um, we offer mental health here at our clinics. We have 3 locations. We also offer personal and family health. We also do a lot more than that. We do a lot of outreach events, whether it be for a ship or just for Neighborhood Health Center. Um, I've been here for almost 2 years now, and my favorite pizza topping is just plain cheese.
Awesome. Okay, Rashinda, thank you for being on today.
Good morning. I'm Rashinda Banks, and I'm the Revenue Cycle Supervisor at Neighborhood Health Center. I manage a team of coders and billers, and Becca's on my team too. So we do all of the outreach scheduling for SHIP. That's what we manage primarily. Sometimes we attend just for Neighborhood Health Center, but our main goal on our team is to make sure that our patients are getting the insurance coverage that they definitely need. So that's mine and Becca's main focus. And I think Becca did a really good job of explaining what Neighborhood Health Center does, kind of in a nutshell there. So thank you, Becca. And my favorite pizza topping is all of them. I like everything on my pizza.
That's my kind of girl. Me too. All right. Last but not least, Cheryl, tell us a little bit about where you are a ship counselor and the work that you do, which we know you stay busy.
I do. So grateful for the opportunity. Thank you so much. My name is Cheryl Fawarda, and I am a navigator. And much like Becca, I also am a CAC counselor. I do Medicaid as a licensed navigator, and just like Becca, I'm just trying to help people have access to all those health care benefits. And I'm also a certified community health worker. So it's a great partnership with Bridges to Health here in Grant County. The clinic is, as I said, one of truly the only free healthcare centers in Grant County, but we do serve other people in surrounding counties. One of the requirements here is, and why this is such a great partnership, most people who come here do not have any insurance coverage. So, we partner and first of all, make sure if they're eligible, we can get them those services. And a great deal of people that I have a passion for, of course, is our seniors. Just love them to death. But my favorite pizza topping is like Rochelle, it is everything.
Sounds like we need to have a pizza party soon. All right. Okay, Susan, would you like to introduce us to your guest today?
Yes, thank you. Mary Beers is employed at Aging and In-Home Services of Northeast Indiana. I hope you all haven't changed your name since I've memorized that. It's the area agency on aging that covers the northeastern part of the state. So she is on staff there. And Mary has a really unique way about meeting clients. And I find it it's kind of the crux of a social worker to meet your clients where they are. And Mary takes that literally. So, Mary, thank you for joining us. And thank you for being one terrific ship counselor.
Oh, thank you. I do enjoy that I get to be out among the people, and we have a lot of people that aren't able to come to our office or come to events, and so I'm able to go to their homes. I'm an options counselor with the agency, and that does give me some flexibility with that.
So, Mary, how long have you been a ship counselor?
About a year.
And what's your favorite part about being a ship counselor?
I think what someone else said is that you just every time is new. There's always new situations, and there's such good support if I have questions about situations, because there's a lot of different ones that I can get answers and really help people.
Right. And your passion for helping people certainly shows through. And we appreciate and I'm sure all of your clients and your coworkers do too. You are one terrific gal, and I'm glad to have been given the chance to get to know you. And be careful when
Thank
you're out
you.
there driving around.
Thank you.
Susan and Mary, very important question. What are your favorite pizza toppings?
Mine is olives, both green and black.
I'm with you, Mary, and I can't really narrow it down, but my favorite pizza is a vegetable pizza. All the vegetables, onions, green peppers, olives, all that stuff.
All right. Thank you both so much. And Judy, I want to go ahead and let you say a little bit about yourself, and maybe you got a shout out or two.
Hi, my name is Judy Gainey, and I am in West Central Indiana. So if you're over in that area and you're on US 41, I'm probably passing you in one direction or the other. I've been a ship counselor. I've been a supervisor since 2017. And before that, I was a ship counselor for 9 years before that at the agency that I worked for. So I'm kind of one of the older ducks in the neighborhood. I have a lot of ship counselors who are also work at health centers and the area, the other agencies like that. And they're either busy with other meetings this morning or they're really camera shy. I couldn't talk anybody into coming on. So it's just me. Um, I think the biggest satisfaction too is just seeing that relief look on somebody's face when you've helped them and they realize how much that you've helped their situation, and that is the best look in the whole world, I think. And all you people who like all that stuff on your pizza, that would give me indigestion. I'm a sausage person, but I love extra cheese on everything. Thanks.
Thank you, Judy. Thanks for coming on today. And she does so much. Yes, and she's burning up Highway 41. So, all right. Well, I don't want to be biased or anything, but I think we saved the best for last. My name is Melanie Garland, so I know I've introduced myself previously, but I'm down here in Southern Indiana, and I am at Vincennes today. I am at Good Samaritan Hospital, and I am joined by one of our newer but very effective ship counselors. So I have Charity with me today. And it didn't take too much arm twisting for her to join us. So we're happy to have her. And Charity, I'll just let you kind of tell them a little bit about your position here. And I know you're new with ship, but you've hit the ground running. So go ahead.
Okay. Good morning. I'm Charity Davis. I've been here at Good Samaritan Hospital for about a year and a half as a licensed health insurance navigator. I'm one of 3 on site. It's a service provided by the hospital. And I was recently certified with SHIP. It's been about 5 months. So I hit open enrollment pretty hard. And my favorite pizza topping is what we call here Farouk, which
Farouk?
is Farouk. And that's specific to a pizza place here in town. So it's the works.
Oh, it's the
basically.
works. Okay. Well, I can deal with that. I can handle that. Yes. All right. Well, we'll let you guys know when we schedule our pizza party. We appreciate you playing along with our silly questions this morning. And, in all seriousness, we really do appreciate everything that you guys do. And just listening to each of your testimonies and where you work or where you volunteer, you really go the extra mile. And that's what's so special about SHIP and SHIP counselors is we are so thankful for all of our SHIP counselors that are aboard our ship and everything that you guys do. So, Charity, I'm going to start with you. So we have a few questions for our SHIP counselors this morning. So Charity and I were kind of chit-chatting before we went live, and I just asked her, I said, so what's been your favorite thing to help Medicare beneficiaries with so far? So I'll go ahead and let you share that.
I think my favorite thing is to talk about the Medicare Savings Program, just because not a lot of people know about that. And it's pretty exciting to let them know that they could, reduce that payment every month. And there's other benefits, for the Medicare beneficiary. And I like to share that just because a lot of people don't know about it. So, and the extra help.
Absolutely. Yes, it can definitely be a life-changing savings for some folks and just open up some new coverage options as well. All right, so let's see here. Let's come back to our gallery view. We'll see all of our smiling faces here. Okay, so Mary, you kind of you go to clients' homes and things like that. So tell us a little bit, maybe tell us a little bit about what do you prepare for when you're going to a home visit? What's different about a home visit versus meeting somebody in the office?
I try to have everything with me. Sometimes I'll forget something and I get there and I find out they have a need maybe that I didn't bring something with, but I try to bring chip material, SMP information, the Medicare Savings Program application, low income subsidy, and um, sometimes I even take my own table to, because depending on where we're at, I may not have a place to really work with, but I want to at least be able to show them what I'm seeing as far as Medicare and the different options with that. So it's just trying to be prepared when I go on home visit.
Absolutely. I remember home visit life, and clipboards were your best friend.
Yeah, I love the storage clipboards.
Absolutely. Okay, Dave, you kind of touched on this earlier, but can you share a favorite client memory of yours with us?
Well, I probably did that in my introduction, but I think what I've enjoyed most with clients is when they after you I like doing new to Medicare best. That's my go-to. I like to do that. I feel more comfortable with that. I know it better, I think, than some of these individual situations. And I think at the end of a discussion or presentation, when they say, gosh, this really has been helpful, that's kind of rewarding again that they've actually gotten something out of the visit. They didn't have to feel any pressure that, oh, I'm not a salesman trying to sell something, and I'm just trying to help them understand. So that's kind of my best memory of all of my clients, I guess, is when they say thank you, that this is really kind of clarified things for me.
Awesome. Yes, I call that when the light bulb goes off. So that's great feeling. Yes. Okay, so Becky, we heard what Dave's favorite client counseling memory and things to explain. So I know you said if Dave doesn't know, Megan does, but maybe share with us something that you've been able to help a client with and have enjoyed.
Sure. And Dave is usually right there with me, so I count on that. And then we always call Megan. But the change in January when people under 65 and disabled were able to get Part D, we had a young man visit us who was losing insurance because his wife was leaving her job. And he had no idea that he had any options other than Advantage. So it was really wonderful to go over his options with him. And he chose a Part D, and it was going to be affordable, and he was going to be able to get his meds. So that was really rewarding. And he was right there at the right time. And the information was given to us at the right time. So it was great for him, and it was great for us.
Oh, that's great. Yes, and we were so excited about that new rule for Medegaps for folks under 65, and we do have a presentation on that. So if you have more questions, you can go through our Facebook page and find that video. Okay, Cheryl, so you've been on with us just most recently, and you shared some of your favorite outreach events. And we know that you're a busy little bee, but can you share with our audience today some of your favorite outreach memories or outreach events to attend?
Oh yeah, I'd be happy to. Well, today actually, I'm going to a Cambridge Square in Marion, which is an affordable housing project, and I am going to be teaching nutrition. And I also always try to bring information with SHIP because I think someone said not everyone knows what the options are in terms of the Medicare Savings Program or extra help. You know, also some of these residents are on disability, so you know that new rule that Dave and, you know, Becca shared about it. I mean, it's just really, you know, being able to marry the two. And the community service supervisor is so receptive to all the information. And I get calls from her quite frequently about her residents. So it's always such a good thing to be able to help many people and be able to just share information about SHIP. And then also the other favorite, my absolute favorite is the veteran stand down. So I get a chance to meet the veterans who have given their service and talk a little bit about how we can coordinate their benefits with VA and then also with Medicare, how important it is that they understand how the two work or don't work. And just seeing their smiling faces, you know, because a lot of them have no idea, you know, how to access those benefits or what is the situation if they have Medicare and their VA benefits. And I just love the veterans. I just love, and I volunteer at the VA here in Marion. So I get to also SHIP at the Northern Colorado Veterans Administration Center here in Marion. So I'm just very grateful to be able to do those things. They're two of my favorites.
Thank you for sharing. Absolutely. Rashinda and Becca, how did you guys first become interested in becoming a ship counselor? What made you want to go through the training and do that?
Well, originally, I really didn't know anything about the SHIP program or anything at all. And April, my manager, she had talked with Sean and Susan both, I believe, invited them to come here to our administrative building in Richmond, Indiana. And they stopped in and they were just going over everything, just giving us the rundown of what SHIP does and how they do it and how it all works and how we become SHIP counselors. And I thought we were doing a lot with just having, in-house navigators, and we were not doing nearly what I then found out we could be doing. And I thought, how great, what a great program. I knew nothing about Medicare extra help, none of those things. And it's really helped a lot of our patients. So, kind of going in like, I'm not sure exactly what I'm getting into here. And it was totally worth it. It's been worth it. It's very helpful to all of our patients. And I think being out in the general public when we do these outreach events, especially around open enrollment time, people get so many calls at Medicare open enrollment time, and it's just confusing and it's overwhelming, and then it becomes annoying. And so when they see the word Medicare, they're like, already, or why are they here, this kind of thing. So I will intentionally approach people like that and just let them know, like, we are here to help. We're not here to sell you something or push something onto you. We want, if you have questions, we can answer them. And so then it kind of changes their perspective, and then they want some of our goodies after that.
Becca, do you have anything to add?
I think Shinda kind of covered it all, but when I started here at Neighborhood Health Center almost 2 years ago, I knew what Medicare was, but I had no idea what SHIP was. But I quickly learned, and here we are today. So, and I really enjoy doing it. I like helping people, not just, we have a clinic here, but maybe not medically, but you can help in other ways.
Absolutely. All right. Well, this is for anyone who wants to answer this, but we kind of have like this unspoken competition during open enrollment where we know that it can be a money savings for people to check their Part D plans for their drug coverage from year to year because the premiums can change, the medication prices on the plans can change, and there were some big changes due to the Inflation Reduction Act for 2025 Part D coverage as well. So, can some of you share with us when you met with a client during open enrollment, did you have any big cost savings where you maybe saved your client quite a bit of money for the next year, or maybe you blew their mind a little bit about changing plans and how much money that can save? So, I'll just open the floor and just go for it.
I'll start. No worries. I was just so excited because I remember this case in particular. It was a couple who I've counseled before, and she is on some very serious medication, and one in particular that has always been covered by the pharmaceutical plan. And since her husband is losing his insurance, he's retiring, that was no longer an option for them. So with the new cap, they were so excited. Yes, it did cost them, some out of pocket, and they were prepared for that. But her medication for the year would have been $37,000. So we were able to find a drug plan and be able to cover her medication. And yes, they did have the $2,000 out of pocket, but once they reached that, which was in January, they were able to get her medication, and they were just so you could just see the relief on their face. And had no idea that option was available to them. They thought that she would have to go without her medication, which was not a good choice for her.
Anybody else?
Well, I'll go while you're all thinking of your client experiences over open enrollment and before. I was in Johnson County at an enrollment event during the open enrollment for Part D. And I met a lady who was fairly elderly, and she had never looked at her Part D options. So I am so glad that she finally came into one of these events, which was co-hosted by a hospital system. And she had a Part D plan that was going to be $131 a month for the premium. Now, I had, in 16 years of being a SHIP counselor, I've never seen a $131 premium plan for Part D. So that was a shocker. The other one was that the lady had never looked at her options in all these years. And so we quickly found her the plan, and she didn't take expensive medicines. So she got the 0 monthly premium plan and had very minimal copays for her prescription drugs. And I'm telling you, she floated out of that room and probably kicked herself a little bit that she'd spent all those years wasting money on premiums that she didn't have to pay. So I'm looking forward to seeing her again next open enrollment. We can't do better than 0 monthly premium, but we'll see what's out there for her.
I think she's sold on checking that every year now. All right, anybody else? Well, I'm sure you guys saved your clients a lot of money throughout the open enrollment season. And we know we just did a presentation. Cheryl actually joined us on that one, where we talk about SHIP counselors and the services and the appointments and things you can help clients with throughout the year. So Charity and Dave both mentioned the Medicare Savings Program and working with clients that are new to Medicare. And so those are things that we can do all throughout the year. And if you have any questions about your coverage, or you need to make a change and you're in that appropriate special enrollment period, or you just want to know if you are, our SHIP counselors can help you and answer any of those questions. So we just want to thank you guys for your time. We've taken enough of it today, I think, but we just want to thank you so much for joining us. And we truly do love our SHIP counselors, and we're so appreciative of all the hard work that you do. I always tell my volunteers, SHIP counseling isn't always the the easy volunteer gig to get. I'd rather go walk dogs at the Humane Society, but the work that you guys do is truly beneficial to those that you serve and that you see. So thank you to each of you for joining us today. And Susan, I'm going to turn it over to you to close us out.
Thank you. And I will add my thanks to all of you and all the SHIP counselors out there. I know we have some watching that are our SHIP volunteers or voluntold. We appreciate everyone's time and effort at helping Medicare beneficiaries in Indiana. And I would like to mention, if you are watching this as a recording, or maybe you're watching it live, if you are interested in finding out more about how to become a SHIP counselor, please call us. Our number is all over everything, but if you want to jot it down, and Melanie or Megan will enter it in the comments, 800-452-4800, or visit us online, medicare.in.gov. We have all kinds of information about how you too can be a SHIP counselor. And I think you've heard from several folks here how rewarding it is. Now, most of you know we do Facebook Lives 3 times a month. And this was our What to Know Wednesday. We do have one more for February, and that's a Medicare Monday. And we're going to be talking about the M3P, also known as the Medicare Prescription Payment Plan. And this is something that was referred to earlier, how people can spread the cost of their medicines over the year. And this was part of the Inflation Reduction Act, brand new for 2025. So tune in to Medicare Monday on February 24th. And if you aren't available at 10 o'clock Eastern time that day, you can always watch all of our videos on our Facebook page and on our YouTube channel. So thank you all for joining us. Please reach out if you want more information about being a SHIP counselor, and have a terrific day, and happy Valentine's Day week.